The American Indian Health Service of Chicago offers an array of medical services to urban natives, including ones in behavioral health. Those who visit can receive individual, couples, family, or group counseling. We sat down with Administrative Director Bobby Bellinger and Executive Director Ken Scott to talk about how mental health affects their community.
How many people do we serve here? In the city, there's around 45,000 American Indians. Say surrounding counties, I believe she said 55, about 55,000. We serve Indians who are homeless, who are uninsured, who have extensive unmet health needs. And that's not 50,000 people. There's not 50,000 poor Indians in this city. We see on the average here in our clinic with one doctor and one clinical psychologist and staff. We see about 750 people a year.
I think when you work in this clinic, you get to know, because we're such a small population, and a lot of times we're more like a small community. So it's almost like having a clinic in a small town. Our providers get to know the community, they get to know the issues, they get to become more aware of how it is to be culturally sensitive. Here I think we give providers a chance to become more sensitive to dealing with issues that are confronted by American Indians. Here also, we do, if we have a chance, we do hire American Indian provider.
Now, if the folks needing referral, if they had insurance or a way to pay for their care, there's a lot of people out there to take them. But the ones that don't have these coverages, it's very hard. Even we're finding that people with county care, which is Medicaid, there's doctors out here who won't take that. So there's a lot of barriers to the delivery of health care for the Indian people.
A lot of the policies, Ken was a recipient of, he was in boarding school. My mother, she was taken away from her parents at the age of 2 because she had eczema and they didn't think that her parents could take care of her, so they took her away. She wasn't able to go back home until she was 16. So she was basically, she had her culture and her taken away from her. You know, you can't do those things to a group of people and not expect to see negative outcomes.
Mental health care, I believe, is a broad arena. It isn't everybody's psychosis, or everybody's got something or the other. So, in as much, could we do more? Yes, we could. But you must understand that the Indian, if they don't want to come here, they won't. And then that's just choice.